Today we will be learning about respiratory syncytial virus, also known as RSV. We will be learning about its microbiology, how it is acquired in the human system, who is more than likely to contract the virus, what symptoms to look out for, and last but not least, how to manage and protect yourself or loved one from this virus. Before we jump into the microbiology of respiratory syncytial virus, RSV, let's define the virus so we may have a basic building block of RSV. This virus, RSV, causes inflammation of the respiratory system, which includes the airways and lungs. It is an airborne virus that affects children and may also be seen in adult cases. But in this case, let's learn about how RSV affects children.
Hello! Can anyone help me? My daughter, she has a runny nose, cough, wheezing, as well as a slight fever. And it looks like she is having trouble breathing. Her intercostal muscles are being used. Please help! She's only an infant. Hello!
Azaria?
She's right here!
If you may both follow me to room 10, the nurse will be in to see Azaria promptly.
Good morning. Are you Azaria's mother?
Yes, my name is Jessica. I'm Azaria's mother. I'm extremely worried. Can you please help my baby?
Jessica. My name is Yvette. I will be your daughter's nurse today. May you please explain what happened to your daughter today or in the past week?
I don't know why my daughter Azaria is like this. The only thing that I remember that occurred this week is that I took her to daycare and we went to Chuck E. Cheese.
Okay, I understand. And I understand that you are worried and frustrated. But at the daycare that your daughter attends, did you notice any other sickly child?
No, I'm sorry, I didn't notice.
It's okay. There is no need to apologize. Now, I know there were a lot of people, and we cannot control the amount of bacteria or viruses that are present. But did you notice your daughter around other sick children when you went to Chuck E. Cheese? Or did she touch something and perhaps rubbed her eyes? Touched her nose or touched her mouth?
No, I did not. Again. And I do apologize. There was just too many people there. I was more focused on not losing her in the crowd.
It's okay, Jessica. I understand. I have a little one of my own. I'm going to listen to Azaria's lung sounds, as well as check her oxygen saturation levels. The doctor may want to run a few more tests.
Is she okay?
When I listened to her lung sounds, I heard wheezing. And I can see that she is using her intercostal muscles, which indicate she is working hard to breathe. In other words, has labored breathing, also known as shortness of breath. I'm going to go and alert the doctor so we can run tests.
Okay, thank you.
I alerted the doctor and she will be in momentarily. If you need anything, there's a call light next to Azaria's bed.
Okay, thank you. Shh. It's okay, my baby. Mommy is right here.
Hello, Mrs. Jessica. I'm Dr. Stone. I'm sure that the RN Yvette informed you that some tests need to be taken on your daughter.
What tests need to be taken, Dr. Stone?
The samples are called rapid antigen tests and molecular tests.
I'm sorry, but I don't understand.
I'll explain the testing for you. The rapid test that is collected via nasal swab, and the rapid antigen test checks for specific antigen that contain the respiratory syncytial virus, RSV, protein. If the protein shows on the test, this means that the test results came back positive, saying that the patient, or in this case your daughter Azaria, has RSV.
Okay, I understand. What about the other test? I believe you said it's called molecular test.
Yes, this is correct. The name of the other test is molecular testing. This sample includes a nasal swab and is also a real-time resulting testing. However, this test checks for smaller trace of RSV antigens.
Are there more testing that can be done?
Yes. In addition to the previous testing that were mentioned, there are also tests known as RSV antibody test, which is a blood test that measures the presence and level of antibodies in the blood that the body produces in response to an RSV V. Infection, indicating either a current or past infection. Viral culture is a laboratory test that strives to identify viruses causing an infection by growing them in a controlled environment, such as a petri dish, and observing the changes. Radiograph, also known as X-ray machines, which is used to check the lungs for any possible pneumonia, which is an inflammation of the lungs that can be caused by bacteria, viruses, fungi, or other microorganisms. Or bronchiolitis. This is a common respiratory infection that primarily affects infants and young children. It involves inflammation of the bronchioles, the small airways in the lungs, and lastly, the pulse oximetry. This is a medical device that is used to monitor the amount of oxygen saturation levels in the blood.
Thank you, doctor, for explaining the testing process. May you please help my daughter?
Jessica, we ensure you that your daughter, Azaria, will receive the care that she needs. Vet, I have met your patient in room 10. We need a stat. Lab done. May you please put in the order for a rapid antigen test for RSV. Vet.
Yes, Dr. Stone, right away. Excuse me, Dr. Stone. The results are back.
Thank you. Okay, I see the results, and they indicate that the patient is positive for respiratory syncytial virus. I have to go and inform the patient's mother. Ms. Jessica, your daughter's test results came back, and she's positive for RSV. This being said, we are starting treatment right away. The hospital staff and myself will get your daughter ready to receive treatment. If you have any questions, please feel free to ask.
Excuse me, Dr. Stone. If I may ask, what exactly is RSV?
Good question. Respiratory syncytial virus, also known as RSV, is an airborne virus. It affects infants and children. However, it may also be seen in immunocompromised adult cases. It's a respiratory droplet precaution, meaning a small drop of liquid, sometimes so small that it cannot be seen with our regular sight, and a person can become contaminated with the virus through this form. Another precaution is direct contact precaution. This is when you touch someone or something, you can become infected with the virus. And lastly, another way to come in contact with the virus is through touching contaminated surfaces, meaning when an object is impure and has become exposed, and when someone touches the object, they can fall ill with the virus with this type of exposure. Now the reason why a person becomes exposed is due to the virus entering the body through the respiratory tract, which include the eyes or mouth.
But I don't understand. She went to Chuck E. Cheese sometime this week, went to daycare for only 3 days, and stayed home for the rest of the week. I made sure to disinfect the home, and I made sure to bathe her as soon as she got home from daycare and from playing in public places. How did she get like this? I'm always careful.
This was not your fault. This occurs, Jessica. Kids get sick. You're a great mom. Don't be hard on yourself. And it's amazing that you realized the symptoms. To add to that, symptoms don't start to show until 2 to 5 days or weeks. And sometimes, rarely, even months after the exposure. Perhaps that's the reason why you didn't see the symptoms right away, which is due to a time period called the incubation period. The incubation period is the time it takes for an infection to develop after a person has been exposed to a pathogen such as a virus, bacteria, and/or fungi. The incubation period concludes when the symptoms of a pathogen become visible.
How did she get like this? I'm always careful. Now that she has caught it, is she going to catch it again? What symptoms should I look out for? If she does catch RSV again, am I at risk to catch it too? Or anyone else around us?
These are great questions, Jessica. The symptoms that you should watch out for in individuals are just like those that you ran across on your daughter Azaria, such as runny nose, fever, cough, shortness of breath, trouble eating, drinking, or swallowing, To add for educational purposes, signs of shortness of breath are wheezing, flaring of the nostrils, straining of the chest or stomach while breathing, breathing faster than normal, and turning blue around lips or fingertips. And to answer your question of if it's possible to become ill again with respiratory syncytial virus, the answer is yes, unfortunately. Nonetheless, it's usually less severe than the first time someone falls ill to RSV. And to the question you had of who is prone to catch the virus, the answer is anyone can become sick with RSV. However, the population that is at higher risk are infants, children, older adults, people with weak immune systems, or a chronic health disease relating to the heart and/or lungs. For example, if an infant, especially the premature infant's child or elderly, has asthma, they are at a higher risk to have severe RSV complications. Although asthma is not the only immune compromise that may cause someone to become susceptible to RSV, it is always necessary to become aware of the ones around you that may have a weak immune system and keep them safe from the virus, because as mentioned before, they are at a higher risk to have a severe RSV complication.
Okay, I understand. What are the treatments for RSV? And how do I protect myself and my loved ones?
Fortunately, there are antiviral medications and treatments that manage RSV symptoms, such as ribavirin. This is an antiviral medication that can be taken as a pill or inhaled. This treatment is used for severe RSV contamination of child and infant that has been hospitalized. This medication is used to decrease the duration and intensity of RSV. Another treatment is monoclonal antibodies. This method is injected into the body to help fight off RSV. There are two known types: palivizumab, also known as Synagis. This method is used to prevent RSV contamination in high-risk children and infants. Another medication is nirsevimab, also known as Beyfortus. This method is also used to prevent infection of RSV in young children and infants. However, another best option you can do is rest, keep hydrated, use over-the-counter medications for the pain and fever such as ibuprofen, Tylenol, or Motrin. If a cough worsens and turns into croup, a steroid may be given to help with the inflammation in the respiratory tract. And for those that are at higher risk, there is a vaccine for RSV. This vaccination instructs the body to recognize the pathogens of RSV and fight it off. Another way a mother can help, if possible, is giving their child breast milk. It is beneficial for the child to drink breast milk due to the antibodies that are found in it. Another very crucial and important way to protect yourself and family is hygiene, which include washing your hands, cover your sneezes and coughs, avoid contact with other sick people, and disinfect surfaces. And most importantly, do not touch your mouth, nose, or eyes without washing or sanitizing your hands.
Thank you, Dr. Stone. I truly appreciate you for putting my mind at ease and educating me on respiratory syncytial virus, also known as RSV. I'm going to go next to my daughter and let her know that her mama is here with her.
You're so very welcome, Jessica. Your daughter, Azaria, is in good hands, and so are you.
And Jessica, remember, I'm here if you and your daughter need anything.
Thank you, Nurse Yvette. I appreciate you as well.
Now that we have listened and learned from this scenario, let us recap. RSV affects infants, children, and adults with immune-compromised bodies. Respiratory syncytial virus is a virus that causes infections of the respiratory tract. Ways to identify if a person has been infected with the virus, known as RSV. A rapid antigen test, as well as other methods mentioned in the scenario, needs to be done in order to identify the virus. Fortunately, there are 3 known medications for antiviral medications and treatments that manage RSV symptoms that can be taken via pill, inhalation, or injection. However, you may also take over-the-counter medications, stay hydrated, and get rest. Be given a steroid if you have a high-pitched barking cough, known as croup. Remember, the symptoms do not show right away due to the incubation period. Fight against RSV, and to protect yourself and loved ones, it is crucial to practice good hygiene. If severe symptoms such as fever, severe cough, wheezing, difficulty breathing that presents as shortness of breath or rapid breathing, and cyanosis, blue color to the skin due to the lack of oxygen, ever come into play, or any other life-threatening emergency come into effect, call 911 and please seek medical attention right away.